Thank you so much, sir. Devashish, sir. I will try not to overshoot it. I'll try to thank AIOS and Optus people first to giving me this opportunity. I'm going to present today use of ultra-widefield imaging for patient education. I am Dr. Parth Rana from Ahmedabad. So first, some of my disclosures. I have no financial interest whatsoever. My presentation is basically on practical challenges, what we are facing in day-to-day challenges, and basically, Optos can do so many things. Like all of our dignitary presenters, they have already told us about it. So we can see retina, we can even see choroid, we can see blood vessels clearly, we can see through hemorrhage and cataract. We can see even through silicone oil or gas. So this Optos Daytona, what we are using here, is exceptional instrument. In future, they are going to incorporate OCTs. Already, they have incorporated OCT in that, which is going to come in India in I think few months or a year. So that also it will be able to do. So right now, if we see like only one thing we are not able to do with Optos, like we can't see beyond the eye. So that's what I will like to say about it. So this Optos is doing wonderful. We are using it from last February 7th, 2020, and today is the 6th February. So just in a year, we have already scanned more than 6,200 cases and more than 20,000 images we have right now in our Optos. So this thing is wonderful. Like we can do so many things with it, but we are able to do it. We are able to diagnose so many of the things. But what is the benefit with patient? Like, how can we counsel a patient with that? We are able to diagnose it. We are able to see the pathology. But what is benefit to the patient? So my presentation is little bit on light side. I hope I won't hurt anyone's sentiment. I'm just going to show like how we are going to sell it to the patient. So in India, we have three kinds of patients. First is like in eye, we only have one thing that is cataract. We call it like cataractomaniac patients. So all of the people who are like listening to me, like a general ophthalmologist or a retina surgeon, all of them, we are facing this like day and night. Like we have only cataract in eye. We can't have anything in retina or cornea or anything else. Second type of patients, they are Google trained. So they are literated by the Google. And third kind of patient, which is obedient. Like really, if I'll tell you, this species is very rare. So the scatectomaniac patient, when they come to us, it's like I am the smartest man alive and I know everything. So many of the time when we try to explain them what is there in retina, they always have some excuses like this. There's only one problem in eye, which can be only cataract. So when we hear, like as a retina surgeon, when we hear this thing, it's kind of very irritating. And any diminution of vision can be due to only one thing, that is cataract. I'm not writing that word because like so many of the time we get kind of irritated with this word, like why always cataract? There's a retina called thing in your eye. So once the cataract surgery is done, eye becomes kind of bulletproof. No surgery, no medicine is needed. Once cataract surgery is done, it's totally bulletproof. So when patient comes to me after a cataract surgery, after a year or after 5 years, the first thing patient tells to me is like, my surgery is done already. So why this is happening? So I have to explain. There's another part in your eye. So many times, like when we are explaining, like I have even heard I don't have retina. So you need a evidence. So this Optos is giving us this evidence. So when patient comes to me, when I show him this 3D wrap thing, which is already inbuilt in the Optos, so we can just show them. So this is your retinal imaging, and as you can see, this part is inside your eye. It is on back side of your eye. When we explain this, then patient have like little bit of faith on a retina surgeon. Otherwise, they always feel like I have done my cataract surgery. Why something is happening in my eye? So there's a second type of patient. There's a Google trade. Like mainly this kind of patients are from urban. This cataractomaniac patients are from rural setup, but these patients are from urban setup. When we are sitting here, like we are seeing this kind of patient day to day, and this species is increasing. Like they always Google it and then come to us. So they have a lot of questions, lot of doubts are there. they always come to doctor for examination, not for their own examination, to have an exam of doctor's knowledge in his own specialization field, which he took years to excel. So usually they come and try to correlate with the Google literature, what they found and what doctor is saying, if that is correct or not. So to satisfy them also, we need some evidence. So when we are showing them, like this is my today's patient only, a young girl, 24 years old. In right eye, as you can see, there's a RD with PVR and so many of subretinal membranes. And in left eye also, patient is having retinal detachment with membrane. Luckily, in left eye, this macula is on, so she was able to see. She went to optician for like around 8 to 10 times, and they prescribed her glasses, and she was able to see. Suddenly, once she went to a general ophthalmologist, he told this retinal detachment, and she couldn't believe it. The general ophthalmologist sent the patient to me, and I saw the patient. I explained her. I showed her the retinal photo. Then she had like something in mind, like, okay, I can have a retina and it can also detach. So there's one more patient. Like patient came to me with a retinal hole. When we explained, patient was not able to understand how a hole can happen in a retina. So we showed the patient like this is your retinal hole, and when we lasered, so we showed the evidence also that I have already lasered your retina. So we always need evidence. So here we can show the patient, like patient is having a retinal hole. The one patient, like when we saw the patient had CRBO, and we asked, we did FFA, and then we asked patient to undergo the laser. So once the laser was done, patient asked us like how laser was done and what all areas you have lasered. We can show it here, like how the laser was done. There's a one more kind of patient which is like totally obedient. When we ask the patient is really ready on the same day, same time. Like this species is like really rare, but this kind of patient tries to understand what doctor says and try to obey. But so many of the times, like what happens is retina surgeries are not rewarding like cataracts. So many of the time when patient is not having 6x vision, the relatives comes and they ask for a second opinion, or they ask for evidence like what has happened and why you have not got any good vision. Because when they hear about cataract on second day or third day, patient is having like 6x vision. So why for this surgery you have spent this much and you still don't have that good vision? So to maintain patient trust, we need some good evidence in our hand, like what has happened and what we did. So this is one of my patient. A patient was having giant retinal tear. So before surgery, I showed the patient like your retina is like totally fallen like this. It has tore apart. And on the next day of the surgery, as you can see here, this picture is just from the next day of the surgery. As you can see, from silicone oil, from so much of corneal edema, I was able to take the picture and I was able to show it that your retina is on. So right now you are able to see. You are not able to see totally. Your vision is little bit less, but your retina is on. So my part is almost done. So many of the cases we are able to help the patient like that. There is one more case like giant retinal tear, and patient was not able to understand like how can it happen, and I just showed the patient this is the thing and it has fallen like this. So when patient saw the picture, patient was able to imagine like how it has happened, and patient understood, and patient went for surgery. Patient was already a fake. We operated the patient. On next day, patient was able to see, and we showed like your retina is totally on, and patient was kind of happy. So even like this kind of cases, like for retina, it's not just for medical purposes. We have already seen so many of the medical cases where like so many of the thing happens, but for surgical things, like so many of the holes or like this giant retinal tear or this retinal detachments, we can even plan surgery with this. We can explain the patient like what has happened, and even after surgery what I did, I can even show like this is like 360-degree laser barrage I have done for you. This hole which was there, I have done a cryo there. Even your retina is totally on. You are able to see in center. Your peripheral vision might be a little bit less. I can explain everything through this, and patient is able to correlate the things. When patient is able to correlate the things, then patient will have the continuous trust on doctor. Because right now, this whatever things are happening outside or WhatsApp or whatever thing we can tell, patient's trust on doctor is little bit less. But this is the thing where we can gain the trust of patient. We can explain the patient. We can even take the patient where we want. Like patient's understanding is very less, especially for retina. So we can take the patient at least to a level where patient can understand what we are doing and patient can have trust on us. So this is one more case. Patient had a huge hemorrhage and patient was not able to see. I explained the patient, you will be able to see from like a little bit sides, and patient understood like, okay, this is the same kind of thing. Even I asked the patient, you are able to see something like hairballs in your eye, and patient was able to correlate. When we operated the patient, patient's vision was around 624. So I can even explain the patient, as you can see, like I have done whatever lasers I can, and like retina is totally on. Slowly you are going to get the result. But before the result was before the picture was like this, but right now we are able to see your retina. So patient also gained the trust with that. I'll show one more case. Like this was the pre-op hemorrhage, and we operated the case, and patient had the picture like this. So this is one more case I like to show. Like this patient came to us just few days ago only. Like when we did optos, I can see just faint disc here. Like in my indirect ophthalmoscopy, I was not able to see anything in the fundus, but we saw a faint disc here. Then we operated the case. When we operated the case, we saw a large cyst in the retina, and there were there was a sclerosed vessel here. So I explained the patient like we found this below your retina. In B scan, we already showed the patient like something like this is already there. But when patient saw, like when the hemorrhage was removed and patient saw like this cyst is like this and something was wrong there, then patient understood, patient correlated with that. I explained the patient like you are able to see around 75% of your visual fields and 25% of the area, like you are having something like this. So patient was able to correlate and patient was able to understand. Patient went already to multiple doctors before, but patient was not able to, was not satisfied properly. But once I showed the patient this images, patient was satisfied with that. So these are the last images what we took and we showed the patient. And still the patient is continuing with me just due to one thing, because patient is able to correlate what I am showing to the patient. Patient is able to correlate the things with that. So the reasons why patients don't trust doctors right now due to some popular TV shows with some actors, national award-winning actors, some popular movies also, and some of our colleagues with negative marketing also. So there are a lot of things happening in the market. But if you want to gain the trust of your patient, you have to go to a space where patient don't let everyone go there. And if you want to reach there, you need some confidence. You need to have some correlation with the patient. So this getting this correlation, you need a proper image. You can even get it with the simple fundus camera also, but a simple fundus camera is giving you a central picture when peripheral things are there. Like as I showed, this in periphery when these holes are there, and if I have lasered this hole, so I can't show it in this simple fundus camera. So Optos is the only technology which is able to do it, and right now, like it is the need of the hour. So in future, it is the thing. So right now, as we can see, like its prices are quite high. Not everyone is able to afford it. But in future, I think even optometrists are going to have it. I'm not talking about like ophthalmic surgeons. Even optometrists are going to have it because this is the future. I mean, undilated picture, if you are able to see till this periphery, this is the future. As I told before, like so many of the cases, like when people were avoiding, like our colleagues were avoiding to do fundoscopy when they want to do the LASIK on the same day. Now they are sending the patients because they know we don't have to dilate to see the periphery. So this is changing some habits. This is changing habits not only of retina surgeons, of general ophthalmologists also, and it's going to change the practice pattern. Like right now, when patient comes to me, this all of the patients they have already done optos and then they are coming to me. So many of the time when I'm missing a few things in indirect ophthalmoscopy, as Namrata madam told before, like. When we are seeing fundus, if we have missed one clock hour and if we have missed one hole and we have written like this normal fundus and you go ahead for your LASIK surgery, this is a kind of legal document we are providing to the patient. So patient can sue us on that. But when we are showing a fundus photo, like it is totally clear, clear image, and then we are writing it, then it's kind of hardcore evidence we are giving with that. So at the time of presentation, patient didn't have anything, and specifically for this montage thing. So this montage thing, what periphery it is able to cover in undilated, it's not possible for any other cameras to do that, and it's need of the hour. So I'll conclude my presentation here due to the shortage of time. And one thing I'll basically like to tell, this is an evidence-based treatment. So I'm able to tell my patient that this is the evidence you have in your eye, that this problem is there in your eye, this is evidence. I am able to give them evidence that I have treated you, whether the treatment has happened or not. If anything is wrong, even you are able to see this is the evidence. So this evidence-based treatment is possible only with this ultra-wide field imaging. Thank you.